Community Outreach.
Thank you all for being here tonight on this beautiful day to listen to us tell you about our agencies. It's wonderful to be a part of this. My name is Carrie Whitaker. I'm the Executive Director of Community Outreach, and for those of you who aren't familiar with Community Outreach, it's a social service agency down on Ryman Street, right off of 9th Street, that provides an array of social services, including housing, food, shelter, medical care, child care, dental care, drug and alcohol counseling, behavioral health treatment services. The sheet I just sent out to everyone will explain our services more in depth, because I'm not here to talk about our services as a whole, but the grants that we put forward tonight. We have been operating for 40 years, since 1971, and we really live by the motto that everybody deserves to be treated with dignity and respect, regardless of their circumstances, and offer the skills, knowledge, and assistance they need to help themselves lead healthy and productive lives. And we work really hard to make sure that happens. We have a total of 10 different programs within our agency, and together they work to provide a continuum of care for somebody who comes through our front door. But tonight I'm just going to talk about 4 grants that we've submitted to the United Way for your consideration. The first grant that I'm going to talk about tonight falls into the education category identified by the United Way as a funding priority. We worked really hard to make sure that all of the grants we submitted tonight fall into the funding priority categories, understanding how important it is that the funding that you guys distribute goes to those funding priorities. So I'm going to talk about family support services. That is a grant that encompasses 3 of our programs: our case management for families, our therapeutic child care, and our families in transition program. The case management services are offered to anybody staying in transitional housing. They work one-on-one with the case manager to ensure that the children that are a part of their family their needs are taken care of. We provide homework help, we provide parenting classes, nutrition classes, we do DHS reunification, sort of anything. We work one-on-one with parents staying in shelter to ensure that those kids get their needs met. We make sure the kids stay in the schools that they need to be in, get the extra help that they need through the case management services. Our therapeutic child care is the child care on site, and it operates 5 days a week, kids 6 weeks old to 5 years old. It's a little bit more intensive form of child care. Really work on behavioral issues versus education type things, to give them just a little bit more in-depth way of doing that. And part of that is like a second step program where we offer anger management classes or anger management program to kids that age. And then the final program in that grant is our families in transition. Those are families that have been at community outreach, transitioned to permanent housing. We follow them out into the community to make sure that those needs, once they find permanent housing, are still being met. They come back on site, they're still able to access our daycare, they're still able to access all of our services at community outreach, even though we found them permanent housing. It's incredibly successful at keeping people permanently housed, that component of case management. The second grant I want to talk about is our integrated housing grant. We asked for $21,000. Our integrated housing provides emergency shelter as well as transitional shelter to men, women, and families. That grant falls under the funding priority of income, where we provide immediate and long-term help to stabilize low-income and fixed-income families. We also submitted a grant for food under that as well, both of those needs. Integrated housing, we provide emergency shelter and transitional housing, including food and other basic needs for men, women, and families. Emergency housing provides housing for up to 7 days every 90 days. And our transitional housing program includes that case management component for everybody. And classes included in that case management are things like life skills, parenting, nutrition, financial literacy, and stress management. The food, we offer 4 food banks that 3 of them are on site at community outreach. The other is off-site at our permanent supportive housing location down at Benton Plaza, where we provide case management services to folks in the community who are suffering from mental illness or disability. Our community food bank serves the community at large. Anybody from the community can come in and get food once every 30 days. Our shelter food bank feeds folks staying in the shelter Our Homeless Emergency Services Food Bank is available to people who are choosing not to stay at the shelter, but who access our homeless emergency services in terms of coming in to take a shower, get something to eat, personal hygiene. We have a mail service, all those kind of things incorporated with that food bank. And then the final grant application in front of you today we have falls into the health category for the United Way funding priorities, and that is our health care services that encapsulates both our mental health services, our behavioral health treatment services, and our medical clinics. So our mental health program is open. Both the mental health and drug and alcohol programs are state certified, and they're open to anyone in the community, not just folks staying at community outreach. They're outpatient programs. The drug and alcohol program is an intensive outpatient program. And mental health, oftentimes we'll have a co-occurring disorder. We're certified to help those kind of folks too, and those are people who are suffering from both mental illness and drug and alcohol addictions. We also have a medical clinic where we operate 4 clinics per week, 3 here in Corvallis, 1 clinic in Lebanon. Specialty clinics that are within our medical clinics are a psychiatric clinic, a chiropractic clinic, a diabetes education clinic, physical therapy clinic, and women's health clinic. And then finally we work with the LBCC dental program and also Medical Teams International to bring in dental vans to meet a small amount of the need that this county has for a large problem, which is dental care. And so that's basically the overview of what I'm asking for, and I would love to open it up for questions because I think that's a better way of spending my time.
Got a couple questions.
Yeah.
We heard earlier from, I'm sorry, we heard earlier from the Parent Enhancement Program. Can you talk if you coordinate with them or what?
We do, yeah. So I'm happy to. We at Community Outreach are fully aware that we can't do this all by ourselves, and we collaborate with as many people as possible. Parent Enhancement Program being one of them, Old Mill being one, CARDVA. Really, I can't think of an agency in town that we don't collaborate with. And I think all of the agencies, and I think I can safely speak on behalf of them, try hard not to duplicate services. So if PEP is doing something that, and they're doing it well, we don't do it. We leave that up to them. And so, yes, we work closely with them.
And the second thing is we also heard from Hands on Lynn Benton, and they're saying they've got a new program to provide help with volunteers. Are you aware of that? Or it sounds like you've got quite a
Our volunteer pool.
Program,
yeah, we have. I have not actually ever heard of the program. Help with Lynn Benton.
Hands on
Lynn Benton. I actually have not heard of that program.
Formerly LDvision.org.
Oh, there you go. Oh, that's right. She told us that at the last United Way meeting. That's right. We do work with them some. In fact, our volunteer coordinator just took the training last week from that organization. We have about 350 volunteers for community outreach that do, gardening and work in the child care center and those kind of things. And then we have about 300 volunteers that run our medical clinics. Our medical clinics are paid, staffed, 1 paid staff person with over 300 volunteers that do all of the front end work, our physicians, all of our nurses. We work pretty closely with Samaritan to do a formulary of medications. So yeah, we have a pretty big pool of volunteers.
So that I guess whatever it was before it is now is a pretty valuable service to you?
We work with them, but I don't know if I would call it valuable. I think the partnership is valuable, but I think we do 2 separate kind of things.
How many families do you have as clients?
That we serve annually. If you turn the sheet over that I gave you, it's going to give you the total annual number for last year. Right now I can tell you, looking at the daily census today, our family shelter is full. Within our family shelter we have 8 units. Right now we have 5 pregnant women staying at Community Outreach, and I think 14 kids was the total count today. It depends on the day of the week and what that looks like. And families can go anywhere from a mom with 1 child or a pregnant mom to, we had a pregnant mom with 4 kids come in last week who needed shelter. So it varies. Annually, we serve about 9,000 people total, unduplicated within all of our programs at Community Outreach.
And that's fine.
Thank you very much.
Thank you.